Hello, hi guys. It's Dr. Ario here again tonight with another session of Health Talk. I'm so excited tonight. Thank you for joining in. Thank you for everyone that's been tuning into the sessions. I hope you've been learning a lot and gaining a lot. So today we are dealing with type 2 diabetes. Okay, type 2 diabetes. Essentially, there are two types of diabetes. Type 1, which is the type of diabetes which come about as a result of the body's own immune cells attacking the pancreas, which makes insulin, and this affects the way the body regulates sugars. But that is a condition that most of us, we don't have control over. So I won't be dwelling on that today. I'll be looking at type 2 diabetes. Diabetes essentially is a very serious health problem that is claiming millions of lives each year. It is among the 10 causes of death globally, worldwide, according to the World Health Organization mortality data. Overall, over the years, we've seen quite a significant increase in the incidence of diabetes. So it is something to take note of and not to ignore. So what is diabetes? I'm sure a lot of you have heard of diabetes, or you know of someone that has been affected by diabetes, or you yourself may even have diabetes. It is a condition that affects the way the body regulates sugar in the bloodstream, resulting in a high level of sugar in the bloodstream, which actually the body doesn't need. Essentially, when we eat, the body uses glucose or sugar, which we get from our diet, so our food and drink. It uses it as its major source of energy, a bit like how you use petrol for your car to get your car moving. When your car doesn't have petrol, it wouldn't function, isn't it? It wouldn't move. So the body uses glucose or sugar as its main energy source to be able to perform its daily functions. And the body can also make, to a small extent, its own natural sugars using its natural stores, but predominantly it does rely on what we eat and what we drink to be able to get glucose or sugars. Naturally, when you and I eat, we get an influx or an increased rise in sugar because we're just eating, we're giving the body some sugar, we get an influx of that sugar in the bloodstream, which is fantastic for the body. Naturally, what that happens then is that the body then releases a special chemical called insulin from a small gland in the body called the pancreas. It releases the insulin, and what insulin does, that it helps the cells to mop up or to pick up all that sugar into the cells where it is actually needed, so your organs can then use it for its daily functions, which will transpire as you being able to carry your daily day-to-day activities. Okay, so naturally the body actually does need that sugar to be able to do that. What happens in type 2 diabetes is that the body is either not making enough of this special hormone called insulin, or is making a certain amount of it but it's not responsive to it, what we call insulin insensitivity. So what will happen is that when you and I eat, we get this influx of sugar, but because the body then releases a certain amount of insulin, it's not able to mop up all the sugar. So you still end up with a bit of sugar or quite a lot of sugar in the bloodstream, which is not good. It's a bit like not having enough manpower to do a major task. So just imagine you have a big project which needs about 100 people to complete that project, to do it really well, okay? And then you only end up having like 10 people or 20 people out of the 100 people that you actually need. Those 10 people or 20 people will definitely not complete the project, or they will struggle or work harder to be able to complete the project over a longer period of time. So your insulin is like that kind of manpower that the cells really need to help them to take up all the sugars in the bloodstream, so they can really use it effectively, so that you can have lots of energy to be able to do your normal day-to-day activity. Does that make sense? Yeah. In the case of insulin insensitivity, like I said, you have some amount of insulin, but your body is just not responding to it. And what happens is that the cells then feel starved of sugar or feel starved of energy because they're not receiving the energy they need to get. They're not being able to pick it up, even though they are swimming in a sea of sugar, because there's so much, sugar still in the bloodstream, but they're just not responding to it. So in each case, whatever the case is, whether you have enough of it or you're not responding to it, you still end up with a lot of sugar in the bloodstream. And having too much sugar in the bloodstream is not good. Now just imagine, for example, like a cup of sugar or even a teaspoon of sugar granules, okay? You put it on a table or you put it on a plate and you add a bit of water, yeah? And then after a few seconds or even to a minute, just try and pick it up with your fingers. It feels a bit sticky, isn't it? The same way, when you have too much sugar in your bloodstream, it just makes the blood a bit sticky and thick, which is not really good, because your blood needs to be able to move in a very fluid way to be able to take nutrients around the different parts of the body. But also when blood becomes thick, there's problems like becoming clotty, so it can form clots, and clots ending up in the wrong places can cause problems. And we can talk about some of the problems that type 2 diabetes can cause as we go along further. All right, so what are the symptoms of type 2 diabetes or diabetes in general? What should you be looking for? How would someone feel if they have diabetes? The scary thing with type 2 diabetes is often we don't pick it up early because the symptoms can be so non-specific. So often people will present a bit later on, and actually type 2 diabetes is more common from sort of age 50 and onwards. But even now we are seeing young people, in their 30s and their 25 actually with type 2 diabetes, which is scary, okay? So, but normally the symptoms will be more insidious. So it will be sort of a gradual onset of symptoms as opposed to presenting very rapid symptoms, okay, and very quick symptoms. So patients might come reporting like, I'm weeing a lot all the time. So they're passing a lot of urine all the time. They feel like weeing all the time. They might also say, I feel thirsty all the time. And sometimes people get these two mixed up, because sometimes you can easily say, am I peeing a lot because I'm drinking a lot? Or, am I feeling like drinking a lot because I'm peeing a lot, so maybe I'm dehydrated? So you see, some people can have these symptoms for months, but they sort of excuse them away because they think, I can explain it away because, yes, I've been drinking a lot, so it makes sense that I'm peeing a lot. And actually, it could be because you have diabetes. Also, people might present feeling very tired. So feeling very tired all the time, not because they're not having enough sleep, not because they've been working lots of shifts, not because they're just tired and they can explain it. They're just feeling, the body is just generally feeling weak and tired. They might present as weight loss, and this is even more common in the type 1, but also you can get initially in the type 2 diabetes, people might present with weight loss, even though in type 2 diabetes, patients tend to be on the bigger side. The other symptom that the people might present with is a recurrent infection. So people might be getting thrush symptoms, which is yeast infection in the vagina. They might present quite often with that kind of infections, or they might present even with urine infections. Commonly, they might present with that. People might also notice that, when they have a wound, it doesn't heal quickly. So normally, if you and I, maybe we had a little cut, usually we bleed, then the wound starts closing up. Within a day or two, we start seeing changes. But people that have diabetes, often they will notice that, they've had this wound for 3 weeks, for 4 weeks, and it's actually looking still very fresh. It's not really healing. And that might be a sign of you having diabetes. The reason why we get some of these symptoms, for example, the weeing a lot and feeling thirsty a lot, is that, naturally, when you have too much sugar in the body, like I said, sugar is actually a good thing for the body. The body needs it. It's its main source of energy. So the body naturally doesn't want to get rid of sugar, right? But when you have too much of it, then it's actually detrimental to the body. So the body then, which is very smart, says, okay, I need to get rid of it somehow. And our kidney, which is a very valuable organ in the body, is the one that actually filters out things from the body. That's why we pee it out. It's a form of waste, okay? So the body thinks, I have too much sugar, I have to get rid of it. That's why the kidney keeps pouring out a lot of that. So often if you test someone's urine, someone that has diabetes, when you test their urine at that time, you're going to notice that they actually have a lot of sugar. You notice the presence of sugar in the urine, and that's actually a screening test for diabetes, because naturally you'll be thinking, why is the kidney getting rid of sugar? It shouldn't normally, okay? And also the reason that you feel tired is because when the body feeling starved of sugar, remember when I said in the other case where you can be insensitive to the sugar, so there's sugar but the body doesn't respond to it, it's not aware of it, okay? So the body will still be thinking, no one is giving me sugar, so what should I do? The body then reaches out to its natural stores, maybe to the fat stores initially, to try and break it down to make some form of energy. It will still carry on, try and break down some proteins, which naturally wouldn't normally do, because you know we need proteins for our muscles, but the body tries to compensate for the problem, so it's trying to break down other things. So often that's why there might be an initial weight loss. Also you feel tired because actually when you overuse those other natural stores, you make some chemicals and toxins in the body, which actually can then cause all the symptoms of feeling tired and feeling weak, and then having infections as well. So I hope that makes sense, okay? So what are the problems, the serious complications that you can get with type 2 diabetes? You know, it is a bit sad because unfortunately my experience has been that most people actually do not take diabetes seriously. You know, often I will hear people say, oh, well, it's just about sugar, isn't it? Is it about just what you eat? So they don't really take it seriously. And because they are not actually seeing any symptoms or they feel well in themselves, they just they're not bothered. But please don't be fooled, okay? Diabetes is one of the serious, I'll say that again, is one of the serious health problems that you should pray for and hope that you don't actually get. Because the problems that it can cause are major and frightening, okay? And I'm going to take you through some of those problems. Diabetes can cause nerve damage. The reason why you and I feel sensation, we feel things when somebody touches our skin, is because of our nerves. The reason why we feel pain is because of our nerves. Can you imagine if you can't feel pain? So this is what happens in diabetes. You get damage to the nerves. That normally will give you feeling, will give you sensation. So for example, it might transpire as this. If normally, maybe I'm walking and I step on a nail, naturally I will scream, ouch, right? Because I just stepped on a nail. My brain sends signals to my pain nerves, which will tell me you've stepped on something dangerous. And then I will go, ouch, and lift my leg up and basically attend to that wound. And I hope that obviously I haven't caused any serious damage to my foot at that time, but I will seek help quicker. In diabetes, where you get damage to your nerve, a diabetic person might step on a nail and not realize that they've just stepped on a nail. So they might just walk on, and later they might then realize, but it's too late, because one, they did not even see that has happened, they did not attend to the wound, there's risk of infection. It's also because of this nerve damage, people with diabetes are increased risk of amputations. Diabetes is the leading cause of non-traumatic amputations. That means the amputations you did not get because you were in a road traffic accident or someone, harmed you or anything like that. From disease, diabetes is the leading cause of amputation. I mean, amputation is a drastic thing for anyone to go through. It's serious. Can you imagine having two legs and then ending up, suddenly with one leg? It changes your life forever. That person's life is never the same. You can make the most of it, but it's never the same. It changes your quality of life. So it's really, 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 really important that we pay attention to this. Diabetes increases your risk of blindness. It causes blindness. You've only got two eyes. To lose those eyes, I mean, if somebody is born blindness, they are used to being blind. But can you imagine living most of your life actually with your eyesight and then suddenly losing your eyesight? The trauma that can cause you. But this disease, which is just a bit of sugar, just a bit of diet, can actually cause blindness. So this is serious problems. And diabetes is the leading cause of blindness worldwide. Now, thankfully, in the UK, it's not the second leading cause of blindness. That's because a lot of drastic measures have been taken now to try and control and manage diabetes so that we can prevent some of these problems. Diabetes can cause heart disease. We're talking about heart attack. So these are big systems of the body. This is not a bit like, oh, I just had a scratch on my skin, that kind of complication. This is big organs in your body that diabetes is actually affecting. Your heart. Diabetes can cause kidney disease. It's the major leading cause of kidney failure. I'm sure you know of someone that this has affected, that is perhaps on dialysis or even lost their life because of that. So diabetes is a serious problem. Then the list goes on. Diabetes is a risk factor for cancer. So you see, it's not just about sugar. It's not just about, oh, it's fine. It's not fine. It causes a lot of problems. Diabetes causes erectile dysfunction. It can affect the erection of a man. And you see how this can play out? People can have problems in their relationship because of that. It can affect a man psychologically if they can't perform sexually. So it is a major problem. Diabetes can cause things like vaginal dryness in women. And this can cause discomfort. It can cause pain when they are having sexual intercourse. And it can cause further problems for a woman, because it can affect your mood even to go through that. Psychologically, it can affect you. It can affect your relationship. So these are things that, we can't afford to ignore. You can't afford to ignore diabetes. Like I mentioned before, it increases your risk of infections. Urine infections being one of them. Too much urine infections can have implications on the kidney. The disease itself causes damage to the kidney, but recurrent urine infections can cause kidney disease, more problems with the kidneys. Because diabetes is a long-term condition, it's a long-term problem with long-term implications. Because someone that has had nerve damage is a permanent damage. It's going to have problems. Someone that has heart attack, you're never the same. It's weakened your heart. It's a long-term problem. So long-term problems such as diabetes can cause depression because it can be stressful for a person. They end up on many medications because they have to try and treat the heart attack they've had, to treat their nerve problem, to treat their kidney problem. So you can end up from never having tablets to having multiple tablets, going to see clinics, going to see doctors, in and out. And it can affect you because it affects your quality of life, affect your employment, it affects your finances, so many things. Diabetes can increase high blood pressure because too much sugar in the bloodstream actually damages the blood vessels, and this can cause high blood pressure. And you see, having high blood pressure and diabetes together are double trouble because those two are major risk factors for heart attacks, for strokes, and many other problems. So you started with one and then you added more problems to it. So you see, it's really important. Now that you know how serious diabetes can be, how can you and I prevent ourselves from getting type 2 diabetes? Because the evidence suggests that type 2 diabetes is actually predominantly as a result of poor lifestyle choices, particularly when it comes to diet and physical activity. Now, I did a lot of sessions on obesity and exercise and diet, which I've got on the Facebook page and on YouTube. So please, you'll be doing yourself a favor to give yourself time and have a look at them so you can learn in detail about those things. So this type of diabetes is the one that is preventable. By far and large, is preventable, and you and I can actually do something about it. So how do we put it to practice? First, with our diet. You need to be aiming for a low carbohydrate diet. Like I said, sugar, glucose, is the main source of energy for the body. Now, our main source when it comes to the macronutrients, when it comes to carbohydrates, when it comes to proteins, when it comes to fats, which is the one that we have in large quantities in our food, when it comes to those things, carbohydrates are the main source of energy that we give to the body. They are the main source, because the starchy foods, your breads, your potatoes, your rice, which we eat a lot of, your pastas, those are the ones that have a high quantity of energy. So we eat most of it. But those are your high carbs. But what you need to aim for is to reduce the amount of carbohydrate that you eat, because you don't want to give the body too much sugar, okay? Because every time that we give the body sugar, all right, we give a high influx of sugar, the body needs to make a high amount of insulin to be able to mop it up. Insulin naturally actually makes you put on weight. And that's why people that are actually on treatment with insulin, they do gain weight, because insulin increases your appetite. It makes you eat more, so you put on weight. But normally, if we have the right amount of sugar in the bloodstream at a steady flow rate, so this goes to the people that overeat when you shouldn't overeat. If you're eating too much of what you need, the body naturally can cope with a steady flow of sugar. So it will release the right amount of insulin. But if you have a high amount, then it needs to make up for it. So it needs to release more insulin to be able to tackle the problem. So you need to be aiming for a low carbohydrate diet. You also need to be aiming for a low calorie diet. For those of you that watched the series on obesity, we talked about your daily requirement, your daily calorie intake. I'm not going to say it to you. You need to go and watch that clip, okay? So you need to aim for a low calorie diet. So you need to be paying attention to when you go and buy your food. Yeah? For example, if you go to Greg, which is a sort of a cafe in the UK, if you pick up an almond croissant, for example, it has almost 200 calories in that just one. So imagine if you pick 3 of that day, then you decide to have a hot chocolate on top of that, then maybe you decide you want to treat yourself to a donut, you know, and then you had a sandwich. So you can imagine even within a lunch, you may have had almost coming up to 1,000 calories. Then you would then have your dinner later on. You may have had a breakfast, okay? So it adds up. So maintain a low calorie diet, and you learn more of that by watching the obesity series. Also, eat the correct amount of food daily, and that goes with maintaining a low calorie diet. Avoid skipping meals, because most of the time I hear people say, you know what, I'm actually not eating much. I don't even eat breakfast. I barely eat lunch, but I'm still putting on weight. That's because actually you're not helping your body's metabolism, because naturally the body needs a steady flow of energy to be able to function. Okay, so your breakfast is your most important meal of the day that you should not be missing. When you have your breakfast, you're giving your body that early boost of energy, okay, that will keep it going in the day, and actually helps the body to keep a steady metabolic rate. Now, what some of us are doing is that we skip our breakfast, okay? We don't eat, so we starve the body already. We put the body into a fasting state, into a starving state, and then maybe at lunchtime we might even eat. But then dinner time, we then eat such a high or a large quantity of food. So then we give the body, which we've been starving most of the day, a very high influx of sugar, okay, which the body cannot handle at that time. First of all, in the evening, you're not very active in that evening, okay? And you'll be eating a lot, that the body doesn't actually need that level of energy at that time. So what is the body going to do with it? The body will think, let me store it up. So the body will store it as fats, okay? And naturally, your body synthesizes or makes its fats in the evenings. And that's when most of us are not really active. Because naturally, when we all eat in the evening, you've had a long day, you want to rest. So after a meal, you just probably watch a bit of TV or read a newspaper or read an article, whatever your profession is. Then, you know, you're going to sleep. Within an hour or 2 or 3, you're going to sleep. And when you're sleeping, your body is not doing gymnastics. Your body doesn't really need a lot of energy. It's at rest at that time. So it's not going to have any need of that food that you've just given it. So that's why it's important that you plan your days as well. Make sure you have a good amount of, you have your good breakfast, and then in the afternoon, have snacks, have healthy snacks. Plan ahead, plan your meals. Have healthy snacks. You might buy yourself some almonds, buy some cashew nuts, natural nuts. Have some things that, so that you won't be snacking on unhealthy foods, which gives you a burst of sugars quite quickly, but also makes you very hungry quickly. So you end up eating more. How many of us, when we open a pack of biscuit, if not because, sometimes we have to go back to work or our lunch break is, over, we will finish that biscuit. Because it's nice, it's sugary, but actually, it goes so quickly. The body's just, get rid of it quite quickly. And then you find that you're still hungry again, and then you want to eat. But that was a very high calorie item of food that you just took, which actually was not really good for you. The other thing we should be doing is exercise regularly. And I did a bit of obesity and exercise in one of my videos, so please go and watch that. There's a daily requirement of exercise that each and every one of us needs to be doing daily. Exercise is good for you. It helps your metabolism. It helps how the body regulates its sugars. Take medication if needed, because for some people with type 2 diabetes, or people that have diabetes, actually, maybe by the time you were diagnosed with that diabetes, it's a bit advanced, because you presented either, because often, even in my profession, we've noticed sometimes people might present because they were having issues with their eyes. So they've already had some damage to the eyes before. That's why they came to see a doctor. So they were not even aware that they had diabetes. It was because through screening the eyes, we found out they got diabetes. Some people, they ended up in hospital with a heart attack. And it was at that time they actually found that they actually had diabetes. And it was really badly controlled diabetes, because they didn't know. So they were just living their life as normal. Some people, because they ended up with kidney infection in the hospital, that's why it was found out. So in this kind of people, where when they were diagnosed, the diabetes is really bad, often you will need some treatment to be able to bring the sugar to a right level. So if you need to take medications, you take it. And often some people have bad attitudes where they'll say, no, I don't want to take medication. Are you willing to die? Are you willing to be blind? Are you willing to have a heart attack? You need to ask yourself that. And if you can definitely say yes to any of that, then please go ahead. But this is something that you can do something about. And medications, yes, sometimes they come with side effects. It's not always bad. It's there to treat the problem. But the whole idea is that if you know this in advance, then you'll be doing the right thing so that you don't end up in that place in the first place where you have to take the medications. Seek treatment early. Seek help early. Often some of us, we ignore symptoms. We see it in black and white. It's happening. We just ignore it. I'm too busy because of work. Trust me, if you die, right, next day, there will be a replacement in your workplace. They will shed a few tears, okay, because maybe you were a hard-working employee, and maybe you were friendly, and they liked you, but the work will continue, whether you are there or not. But your health is important. And when you are dead and gone, you're gone. And it's a loss. But your health is important. You are important. You need to invest in your health. So seek help when you need it. Don't ignore things, okay? Get your regular checks. And this is something that I always stress with passion, okay? This body is your main vehicle, okay? It's your machine. The reason why you're able to get up and leave your house, what is carrying you? Is this body carrying you to your workplace? The reason why you're able to take your children to school, is this body carrying you to take them to school? The reason why you're able to marry is because this body, that's what makes you human being, that you're standing there. So someone can see you. So this body is important, so you need to look after it. So go for your regular checks. Your MOT. Most of you that drive, you take your car. It's a car. It's a vehicle. It doesn't have feelings. You take your car for MOT. You wash your car. You treat your car like gold. You look after it. Some of you that are into bags and shoes, you don't joke with them, but you're joking with your bodies. You're joking with your health. You're joking with your life. Take it seriously. Please, do your regular health checks. Go and see your doctor. Check your blood pressure. Check your weight. Then you know how things are. I remember when I had my second baby, I put on a lot of weight. And when I went for my 6-week check, my blood pressure has always been 110 something, you know, always below that. It has always been, you know, on the low side of normal. But when I went for this health check, my blood pressure was like 132. Now 132, you know, is normal, it's fine, okay? But for me, I noticed the difference. And you just need that creeping up of your blood pressure to make a sudden difference. And whether you get a heart attack, whether you get a stroke, whether you get diabetes, it's just like that. I noticed the difference, and I was like, I know it's because I put on weight. That's why my blood pressure has gone up. And it does. But often, I mean, 132 over 76, that's not a bad blood pressure for me. That was a normal blood pressure. But I noticed that my blood pressure has creeped up. And if I had piled on the weight and kept piling it on, I'll be at risk of getting high blood pressure. So you need to wake up. So go for your regular health checks. I hope all that is clear. I hope I'm not being harsh on you. I am that passionate about you, about your health. So I want you to take it seriously. Okay? That's fine. That's free knowledge. Okay? So take it with a good heart. Now, if you already have diabetes, it's never too late. It's definitely never too late. And everything that I've said about the things you should be doing still applies to you. Because you can still make a change. See, if you had one heart attack, you can't go back and reverse the part of the heart that has been damaged. It's already done. But what you can do is that you can prevent a further heart attack. So if you can make changes, then you will reduce your risk, yeah, of further problems. For someone that has lost a limb already, has had an amputation, you cannot reverse time. You cannot go back in time. It has already happened. However, you can make the necessary changes that would prevent you getting a further amputation on the other leg. So it's never too late. And the evidence actually suggests that if you can make changes, especially for those people that maybe you have been told that you got diabetes and you don't have any complications. Actually, there's evidence now to suggest that you can reverse it. You can reverse it if there's no damage yet. So that means that you can start making changes to your weight. You can start making changes to your diet, get physically active, lose the weight if you need to, do whatever is necessary, because you can make changes. And always be proactive, you know, in taking charge when it comes to your health. So when you go and see your doctor, and your doctor says, oh, you know, I think you're borderline, you know, have diabetes. Oh, what exactly does that mean? Ask more questions. Can you tell me exactly what is the value? What is the value of my HbA1c? What is the value? So when you know, so next time when you come, you know when it's dropped, you know, oh, definitely I've made a difference. So don't just be, you know, like a passive receiver, like you don't know anything at all. I hope tonight's message, I hope I've been able to get it across, because you have the power to make a change. You have the power. You can do that through making drastic lifestyle changes, because some of us, we need to make those drastic measures, okay? But you can do it. If you need help, speak to your doctor. Even now we have weight management programs that the NHS provides free for certain people with certain health conditions. So you can actually speak to the doctor. The doctor can refer you. You can have support to go to the gym, to lose weight, to join groups, to lose weight. So the help is there. Speak to your specialist nurse, the diabetic nurse in your practice. They will give you all the information you need. Okay? So don't do this by yourself. If you need the help, seek it. But just do something. Take action. Okay? So thank you for listening to me today. As always, it's Dr. Ariel, just bringing valuable health information to your doorstep, or to your Facebook, should I say, and to your YouTube. So I am on YouTube as well, and I have all my video clips there. Please do listen to them, share with people, you know, because knowledge is power. And most of us, you know, what you don't know, you don't know. Most of us, we don't know. That's why we're just doing whatever we're doing, and it's affecting our health. So please, don't be selfish. Share the information with other people. Like my page. Make comments. If there's any specific topics that you want me to deal with, because there's loads more coming up, but if there's specific ones that you want more about, please just inbox me, tell me about it, or put it under the video clips, and I will do my best to work on it. Okay? So thank you. You've been listening to Dr. Ariel Health Talk. God bless. Stay well. Bye-bye.